Did you know that your skin, your eyes, your nails, even the tiny folds of your earlobes might be quietly whispering secrets about your heart's health? Most people think heart disease shows up suddenly. One day you're fine, and the next day you're clutching your chest. But in reality, heart disease often begins with silent, subtle, surprising clues that your body tries to show you long before anything dramatic happens.
Today, we're going to go deep, really deep, into the 13 surprising signs of heart disease that you can literally see on your own body. Grab a mirror, take a breath, because what you learn today might genuinely save a life.
Frank's sign, the earlobe warning line. Let's start with a place people almost never think to check. Your earlobes. Look closely at your earlobe. Do you see a diagonal line, a crease, or a fold running across it? That crease is called Frank's sign. Why does this matter?
Your earlobe has tiny, delicate blood vessels and almost no fat. So if those vessels are becoming stiff, rigid, or aging prematurely, your earlobe shows it first. And the big concern? If blood vessels in your earlobes are aging early, then blood vessels in your heart might be aging early too.
Now, before you panic, this sign isn't perfect. Plenty of people get earlobe creases simply because they're older. But if the crease is deep and it's on both earlobes, that's when the risk becomes more meaningful. Think of it this way. Frank's sign isn't a diagnosis, but it is your body tapping you on the shoulder saying, "Hey, maybe we should talk about this."
Xanthelasma, yellow eyelid cholesterol patches. Now, move from the ears to the eyes. If you've ever noticed flat, yellowish patches near the corners of the eyelids, that is called xanthelasma. These aren't wrinkles. They aren't pigmentation. They're actually cholesterol deposits.
Here's what happens. Your cholesterol levels get high. Immune cells rush in to clean it up. They eat too much, and they turn into bloated foam cells. And those foam cells collect under the skin, forming these yellow patches. But here's the real danger. The same foam cells that form xanthelasma also form plaque inside the arteries of your heart. Imagine tiny cholesterol-filled cells slowly building walls inside your coronary arteries. Walls that can one day block blood flow and trigger a heart attack.
I once saw a patient, a 40-year-old woman, who had so much xanthelasma around her eyes that it looked like she was wearing glasses made of cholesterol. We call this pseudospectacles. Not only that, she had lumps on her hands and feet called tuberous xanthomas. These were also cholesterol deposits. Her cholesterol wasn't just high, it was dangerously, genetically, sky-high due to a condition called familial hypercholesterolemia. By age 40, she already needed open heart surgery because her arteries were filled with plaque. And here's the shocking part. Even if your cholesterol levels are normal, xanthelasma still increases your risk of heart disease.
So if you see it, don't ignore it. Go talk to your doctor, get your lipid profile checked. You might catch something early, and early is everything.
Corneal arcus, white ring around the iris. Next, look into your eyes, specifically at the colored part of your eye. Do you see a grayish or white ring around it? That ring is called corneal arcus, and it's made of cholesterol deposits inside the cornea.
Now, here's the nuance. In older adults, totally normal. But if you see this before age 45, that is a red flag. Your eyes don't lie. And if cholesterol is depositing in your cornea early, it may also be depositing inside your coronary arteries. Your eyes might be giving you a silent warning that your heart needs attention.
Waxy skin bumps, amyloidosis. Now let's talk about a condition that is rare but dangerous when missed. If you ever see firm, waxy, translucent bumps around your eyes, ears, or neck, this could be a sign of amyloidosis.
Amyloidosis happens when your body makes misfolded proteins called amyloid. These proteins clump together and start depositing in different organs, including the heart. When amyloid builds up inside the heart muscle, the walls become thick, stiff, and rigid. This leads to a condition called restrictive cardiomyopathy, where the heart can't relax and fill properly.
But wait, there's more. Amyloid doesn't just affect the skin. It can show up on the tongue, causing macroglossia. If your tongue looks unusually large or has deep indentations from the teeth, that's a clue.
Around the eyes, causing raccoon eyes. Even light rubbing of the eyes can cause dramatic bruising because the blood vessels become fragile. These signs might look harmless, almost cosmetic, but they can point to a deadly disease affecting the heart. In amyloidosis, early diagnosis saves lives. The earlier you catch it, the better the outcome.
Livedo reticularis, net-like skin pattern. Look at your skin, especially on the legs. Do you see a mottled, net-like purple pattern? This is called Livedo reticularis. Sometimes it appears when you're cold. If it disappears when you warm up, no problem. But if the pattern stays or becomes painful, or starts to ulcerate, this can be a sign of something much more serious.
It may happen if a piece of cholesterol plaque breaks off, travels down the artery, gets stuck in tiny blood vessels, and blocks blood flow. This is called a cholesterol embolism, or it may be linked to life-threatening autoimmune diseases like lupus or antiphospholipid syndrome. If the pattern is persistent, painful, or accompanied by sores, don't wait, get checked. Your skin could be showing you a micromap of your circulation and where it's failing.
Quincke's sign, pulsating fingernails. Now, hold your hand up. Look closely at your fingernails. Do you see them pulsating, moving up and down with each heartbeat? If yes, you might be looking at Quincke's sign, a classic sign of aortic regurgitation.
Here's what happens. Your aortic valve, the valve that controls blood flow out of the heart, becomes leaky. So blood flows backward into the heart in between beats. This backward flow causes an abnormal drop in pressure, and that drop makes tiny capillaries in the nail bed visibly pulse. But the nails are just the beginning. Aortic regurgitation can cause dancing carotid arteries. You can literally see the arteries in the neck jumping with each heartbeat.
De Musset's sign. Your head subtly bobs with each pulse.
Miller's sign. Your uvula, yes, and that little dangly thing in your throat, moves with each beat.
Landolfi's sign. Even your pupils rhythmically constrict and dilate with every heartbeat.
These signs might look fascinating, even strange, but left untreated, aortic regurgitation can eventually lead to heart failure. And these are just the first signs, the ones you can see on your face, eyes, ears, and skin. But the story isn't over. Because your legs, your nails, your breathing, even your pulse carry equally powerful clues. Let's continue.
Pitting edema, the finger test on your legs. Sit down comfortably. Lift your leg. Now press your thumb on your shin or ankle for 5 to 10 seconds. When you remove your finger, does the skin stay dented? That dent is called pitting edema. And it happens because the heart is too weak to pump blood forward. Blood moves slower. Fluid leaks into tissues. Gravity pulls it downward into the legs, the body's lowest point.
But here's the dangerous part. This swelling is often the first visible symptom of heart failure. It starts subtly. Your socks leave deeper marks. Your shoes feel tighter in the evening. Your legs feel heavy after a normal day. Walking becomes tiring, even without exercise. Many people blame sitting too long or salt intake, which can also contribute. But persistent swelling deserves attention. Because pitting edema is not just fluid, it's a message. A message saying, your heart is struggling.
Pulmonary edema, when fluid reaches the lungs. If swelling in your legs is the first sign, fluid in the lungs is the red alert. Heart failure doesn't only cause swollen ankles. It causes water to fill the air spaces of your lungs. And this is when people finally rush to the hospital.
Here's what happens. Breathlessness while lying down, needing 2 to 3 pillows to sleep, waking up gasping for air, wheezing, persistent cough, and feeling like you're drowning from the inside. Some patients describe it as, I can't breathe, I feel like someone is sitting on my chest. Doctors often give diuretics, water tablets, that can remove 5, 10, sometimes even 20 pounds of excess fluid in just days.
It's dramatic. And it shows how much the heart influences every corner of the body.
When heart failure damages the liver, congestive hepatopathy. Most people never connect the heart with the liver, but the two are deeply connected. When the right side of the heart struggles, blood backs up into the veins. The liver, the body's largest internal organ, becomes congested with blood. This leads to liver swelling, pain or heaviness under the right rib, fatigue, loss of appetite, and jaundice in severe cases. Over time, repeated congestion creates scarring. It's called cardiac cirrhosis, liver damage caused not by alcohol, not by infection, but by a failing heart. So yes, when the heart struggles, even the liver pays the price.
Clubbing, the disappearing diamond sign. Here's a simple test. Touch the nails of your index fingers together. Look through the small space between them. Do you see a tiny diamond-shaped gap? If yes, normal. If not, the gap is gone. Your nails are curving downward and your fingertips look rounded or bulbous. This is called clubbing. It's often caused by long-term low oxygen levels. And that can come from congenital heart disease, lung cancers, chronic lung diseases, inflammatory bowel disease, and infective endocarditis.
Clubbing doesn't appear suddenly. It develops over months and years. And when present, it almost always points to an underlying medical condition. So if your fingertips look drumstick-like, it's worth investigating.
Osler nodes, painful finger bumps from heart valve infection. These are small, tender red or purple bumps on your fingers, toes, hands, and feet. Osler nodes are associated with infective endocarditis, a serious infection of the heart valves. How do they form?
Microclots containing bacteria travel through the bloodstream and lodge in tiny vessels under the skin, causing painful nodules. Other clues of endocarditis include fever that doesn't go away, night sweats, loss of appetite, weight loss, and fatigue. Janeway lesions, painless spots on palms and soles. Left untreated, infective endocarditis can destroy valves, cause strokes, cause abscesses, and become life-threatening. So, small painful finger bumps are not always allergies or insect bites. Sometimes they're warnings from the heart.
Splinter hemorrhages, red lines under fingernails. Look closely at your nails. Do you see thin, straight, reddish-brown lines running under the nail? They look like splinters. They're called splinter hemorrhages. They can happen after nail injury, but when seen in multiple nails without trauma, they may indicate infective endocarditis, severe high blood pressure, vasculitis, autoimmune diseases, and blood vessel inflammation.
They occur because small clots or damaged vessels bleed under the nails. Alone, they are not diagnostic, but combined with fever, fatigue, murmurs, and weight loss, they point toward heart infection.
Your pulse, the most underrated heart warning. Now place your fingers on your pulse, on your wrist or neck. Feel the rhythm. Is it regular like a steady drum? Or irregular, fast, slow, unpredictable?
If your heartbeat feels chaotic, like lub, dub, dub, pause, lub, you might have atrial fibrillation or AFib. AFib is one of the most dangerous heart rhythm problems because it forms blood clots in the atria. These clots can travel to the brain, causing stroke. In fact, AFib increases stroke risk by 500%. Symptoms include palpitations, uneven pulse, shortness of breath, fatigue, and lightheadedness.
But here's the real danger. 30% of AFib patients have no symptoms. They only discover it after a stroke. That's why checking your pulse is one of the simplest, most powerful habits you can develop.
From the skin on your face, to the swelling in your legs, to the rhythm of your pulse, your body is constantly communicating with you. Some signs are visible, some are felt, some are silent, but none of them should be ignored.
Heart disease may be silent, but your body never truly stays quiet. It always gives clues. You just have to know where to look. Take these signs seriously and take the next step in protecting your heart. We'll see you in the next video.